My name is Kim Soo. I trained at Harvard Medical School and the Harvard Graduate School of Arts and Sciences. I did a PhD in medical anthropology, and I studied opioid use disorders in prison in Massachusetts among women with primarily heroin use disorders. I'm currently a resident physician at MGH. I spent about 2 weeks in Vancouver in the spring, and I was there to study and witness the events around Insight. Insight is a nurse-driven model in which registered nurses are on staff. There were a lot of businesses that were very supportive. Were trying to employ people in that area to get them out of poverty. And there was a lot of efforts to help get people inside and to not be using in alleys, to be using in the streets, to be leaving needles discarded in the streets, to be safely disposing of their equipment, and to not be sharing and to be cleaning their equipment, also preventing the transmission of HIV, Hep C, and other transmissible bloodborne diseases. One of them is actually run out of VANDU, which is the Vancouver Area Drug Users Union. In the back, they actually have a peer-run supervised consumption facility in which peers who are in recovery themselves supervise other people who are using. They carry naloxone, and they have some tables they bought at IKEA. They have bleach wipes, they have sharps containers, and they have, most importantly, naloxone, the medication to reverse overdoses, as well as oxygen. Thinking about ways that we could make medications easier to access. These are medications that people need. You know, traditionally there have been huge wait lists, right, to get Suboxone or buprenorphine. They're huge wait lists. In Europe, people can just get methadone or buprenorphine in a pharmacy. So what I have to say to Marty Walsh is that I don't know in what other kind of literature you could ignore the public health data that states that they have had 0 deaths in over 15 years of operation. If people were dying of this influenza virus, if that was attacking us and we had a clear solution and it was this, people would just be up in arms. There's a lot of moralizing around these substances, and Marty Walsh and his history of recovery, I think people feel like very entitled to say, like, what worked for me is this, what worked for me is 12 steps, what worked for me is AA. I was strong enough to stop. When we are struggling with an opioid epidemic like this right now, what we need to do is we need to create a toolkit and a wide variety of ways that people can achieve a life that's meaningful for them, whether it's supporting them through ongoing drug use, whether it's helping them to stop when they're ready, if they're able to be with their kids, if they're able to wake up every day and exercise, if they're able to do their jobs, if they're able to be, there for their parents. There's so many different ways that people achieve recovery, and those phases of recovery look very different. So what I feel like Marty Walsh is doing is he's not really allowing for a full range of possibilities. There's over 100 safe injecting facilities around the world. There are many different ways that we could envision and set up our own facility, whether it's in a hospital or whether it's in a homeless shelter. And I could envision that upstairs, if someone comes in and they're dope sick, I could induce them into treatment immediately, without a wait, without all of this other stuff. We could do toxis, and I could do treatment on demand. Her daughter found her dead in her bedroom, incredibly vivacious, and would bound into my office and hug me, and she'd come wait for me in the waiting room in the lobby, even if she didn't have an appointment. And I know she didn't want to die, and I know that at least if we had a supervised injecting facility, she would have the option of not using alone, and she would at least know that she could use and not fear ODing and going out forever. 6 people are dying a day in Massachusetts, and 140 people at least are dying a day in this country. So Action needs to be taken. We know what we need to do, and it's just a matter of sort of lack of political will. All my patients, they're not suicidal. They have a substance use disorder. They don't want to die. Dead people can't recover.